Good morning, friends. Good morning, Makkale. Good morning, Dosto. This is your RP signing once again. Today, we are entering into an interesting discussion, which is refractive laser eye surgery. We have got Ramesh Narasimhan from Sydney, Australia. The time is approximately 6 p.m. there. We have got Harini, young lawyer. Uh, she is with us. She's in her early 20s, and we have got Priya with us. She is, as you have already seen her in one of the previous video blogs, she's an ophthalmologist. Now, regarding this platform, you already know that I Want Second Opinion is a platform that has been set up basically to offer expert second opinions, wherein when you have already have seen a consultant and got an opinion regarding your medical problem, and if you have got any queries or doubts, or if you want to get any second opinion regarding the consultation of what you have had or difficulty in making the decisions, all you can do is write to us at iwantsecondopinion@gmail.com. And if you want us to give further informative videos like this, could you please kindly subscribe to our channel. Now, I'm giving the platform for the experts to discuss now. Harini, there you go.
Hi, so I'm just going to start asking Dr. Priya a few questions. So, Doctor, very simply, could you just please explain what is laser eye corrective surgery and how does it work?
So the eyeball is like a camera, the analog old camera. We have a lens at the front and we have a film at the back. So as we grow, the eyeball grows in different sizes and shapes for all of us. So the average eye, when you grow to about 24 millimeters or something, then you don't have a prescription by and large for distance and, for near when you grow. But in a few people, the eyeball can be smaller than the average. In a few people, it can be bigger than the average. So based on the size of the eyeball, you are either long-sighted or short-sighted. So the laser eye surgery is basically playing with these optics. So if we reduce the curvature or increase the curvature in few places, we can adjust the place where the light would focus on your eyeball in a proper way so that you don't need glasses for correction. So that's why it's called as refractive eye surgery. So we play with the refraction, not play, we make the refraction focus in the proper place for you so that it is better focused. So the shaping the eyeball, changing the contour of the surface of the eye, the topmost superficial part is called as the cornea. It's the transparent lens which we have in the camera. So the thickness of the camera lens is adjusted. That's what it is basically.
So if I want to get it done or someone else, how do you know if you're a suitable candidate for this corrective surgery?
See, absolutely. You need a complete workup. So workup of all the ophthalmology, the checkup which we do. So how to know you're a suitable person? First, you should be over 21. So you're in your early 20s, which is ideal. The second thing is you should have had a stable prescription. Ideally 3 years, but at least for a year. And then history of wearing glasses, whether for long sight or short sight. So if you know this, then when we do the workup for ophthalmology, we'll know how the thickness of the eyeball is, if your prescription is stable. All those things will be taken into account, the retina checkup, make sure the rest of the eye, the pressure and everything is fine. And then we'll know whether you're a suitable candidate. But these three things are the basic.
Yeah. But are there different types of eye surgeries available, or is it just one for everyone? Like, are there different types?
No, see, it depends whether you're short-sighted or long-sighted. There are different types available. Traditionally, it used to be like what's called as the excimer laser or a PRK. But nowadays, that's, because it gives a lot of discomfort, glare and pain and a delayed recovery. That's not the usual one. The most common one, which is usually done, is LASIK, which I'm sure you would have heard of. In this, it's relatively, the recovery is quicker and the long results. We have been doing it for many years now, so the long-term results are also available. A smile is relatively newer concept. We'll have to find out whether you're suitable for it by doing the workup.
Okay, so as someone, see, I go to work. How how many like days in total is the recovery period? Like if I have to ask for days off, so this is one of the main things. So if I want to go and ask my boss like, hey, I'm gonna do this, can I get X number of days off? Or like pre-surgery and post-surgery, what are the exact requirements? Like how long is the recovery period exactly?
See, the usual recovery time is mainly for discomfort, sensitivity to light and gritty sensation and things like that. These are the usual factors. Everybody's tolerance is different, but generally 2 to 3 days you get comfortable. Okay, and though we say the next day you should be able to do normal things, you will know that something is there. So it's better you take at least 2 to 3 days. I'm sure Ramesh would be able to throw some light into it since he recently had. Ramesh, what do you think? What was your recovery done at time?
Yeah, I think 2 to 3 days sounds normal. For from an introduction standpoint, for somebody who I was wearing corrective glasses ever since I was 11-year-old. I've had various types of lenses, through the major part of my life, and I wanted to get away from it as quickly as possible. And I did my LASIK treatment back in 2016, which is about 7 to 8 years as of today. And I remember when I got it done, the first 24 hours was a bit sensitive. The first few hours was, first of all, very, very sensitive. I just couldn't expose myself to any forms of light. So I was in a dark room for that evening, and the next morning was a bit better. But yeah, it takes about anywhere between 24 to 72 hours for complete recovery. And I remember taking, I think, a day off. I managed to do it on a Wednesday, Thursday for my surgery, and then I was back at work from Monday. So if you can time about 2 to 3 days, I think that would be a good time frame for recovery.
So immediately after the procedure, like what does it feel like? Like are you able to see immediately? Like what is that? Like I know you said it was sensitive and things like that, but just immediately coming out of the procedure, how like could you just explain a little bit on how that felt or like
Is it
what that
painful?
It's a bit of it's I wouldn't call it painful, but it was definitely not comfortable. So it was any I would if you take a scale of 1 to 5, 5 being extremely painful and one being no pain at all, I would say it was anywhere between 3 to 4 in terms of pain for the first 24 hours. So I remember walking out of the after the surgery. There was no anesthesia, so I all I could feel was the first 6 to 12 hours. I could feel that there was a bit of so the first six to 12 hours. There was a bit of you feel that bit of irritation when when you have something go into your eyes. That's the kind of irritation that I felt for the first few hours, because as Dr. Priya explained, depending upon your eyeballs, I think the whole corrective measure, they chip off a layer on your cornea. So you would get to feel that sensitivity on the first few hours, and I couldn't see from the vision standpoint. I couldn't actually focus and see or read anything for the first almost like for the first 24 hours, I would say. But slowly, when you start opening up and start your vision also, you're trying to refocus. So there's a bit of uncertainty for the first few hours in terms of your vision. I think it's all natural because your cornea is trying to the refractive because of the refraction, you're trying to get your focus right on these objects. The first few hours can be a little uncomfortable, but I wouldn't say unbearable, but I wouldn't say it's unbearable, but yeah, it's a bit of an uncomfortable situation. But
so it was only for a few hours, is it? Was it only for a few hours? I read somewhere that it can last for 2 to 3 days. You need to be careful, and the glare will be there, and etc. I think it depends upon what kind of laser you had, I suppose.
Yeah, could be. In my case, that evening, I still remember I was requesting my family to switch off the lights, and not switch on the lights in the room that I was relaxing, because it was that difficult. Even with your eyes closed, I couldn't take that light coming up in my room. So I was literally in the what they call as the dark room. Back in those days when we used to develop photographs, we used to do it in a dark room. So I was literally in the dark room. So that I would recommend that to anybody who's doing the corrective surgery. It kind of helps you to keep your pain less. And yeah, it was just few hours. It was not days. It was definitely few hours before I was able to open up and start moving around.
One question: were you pampered, Ramesh, following?
No, not at all. Not at all. It was a very it was not an inpatient surgery. It was like I definitely needed, because I drove to the clinic. So right after the surgery, I needed somebody to drive me back. So I had someone to guide me from the clinic to my home. Yeah, so that was the first. And then I think one other suggestion that my doctor suggested was that not to venture out for the first few days, because of the sensitivity on your eyes. You could be exposed to dust and smoke and so on and so forth. So and yeah, I would recommend the same for others. Especially for young adults, if you are you're riding a motorbike or a bicycle, you would want to stay away from the first few days.
So this procedure, doctor, how long is it for? Like the operation, like how long is it different for each type of surgery, or like approximately average?
The surgical time as such is very, very short. You would be out the room from the laser procedure room in about 10-20 minutes. That's not an issue. Initially you will have the workup, the calculation and all those things. That would be different, but the surgical time as such, and if it is LASIK, it's slightly shorter than SMILE. So it depends on what procedure you choose to have and what procedure your ophthalmologist thinks that is suitable for you.
Is there something I need to do following up to the days of the procedure? Like anything I need to follow?
So again, as Ramesh was saying, you would be sensitive to light, so comfort levels maintenance would be helpful. But we'll give you some drops. Drops, antibiotics, steroids, dry eye drops, and all those things will be there. So Ramesh, how long did you have to use the drops when you had the procedure?
Yeah, so I was told that I had a little bit of dry eyes even before the surgery. So I remember I was on drops for the first 2 years for sure. I had drops all along in my desk. I had it in my car. I had it in my
2 years, is
in my
it because
carry-on.
purely for the surgical point of view, or is it because of your dry eyes?
I had dry eyes even before the surgery, so I was I think I
My
was
question is it Priya might be able to answer. So the drops one has to put for nearly 2 years after this procedure, is it, or?
Everybody is different. So if there was a pre-existing dry eyes, it can feel a bit more exacerbated after the procedure. Everybody's requirement is different. A few may not need, a few might need. Again, sensitivity to light also, how long it happens, it varies from person to person. But yeah, dry eye is one of the known things which can happen, and the frequency of the drops, the duration, and all those depends on the pre-existing and how they feel post-operatively, and the age also comes into it.
Yeah, yeah. I think these days, because we are exposed to devices and monitors, quite longer than usual. Dry eyes is a very common phenomenon. So in my case, I had a dry eyes even before the surgery. So possibly that led to that. But yeah, I was using it for a prolonged time.
Has it gone down?
Sorry, Priya, what was your question?
I was asking Ramesh, has it gone down now compared to what it was before?
The dryness.
Yes.
Yeah, it much better. But I on a long day, I tend to use the drops or splash water just to keep my eyes hydrated.
Can the dry eyes get exacerbated following the procedure, Priya, that you are aware of?
Yes. That can happen, and that will settle down, or it depends on the person again. Sorry, Harini has been wanting to ask some questions.
No, it's okay. So, what is the success rate of this procedure, and are there any factors that affects the outcome?
See, the success rate is pretty good. So no procedure gives you 100% guarantee in the world. Okay, there are risks with every procedure we undergo. Similarly, in this also, there are risks. The flap can dislodge, you can have infection, inflammation, persistent glare, dryness. All these side effects would be explained to you by your surgeon procedure. So no procedure gives you 100% guarantee. But of all the procedures, because we've done LASIK for such a long time, now it is a highly successful procedure. So what was the other question?
Just what are the factors that can affect the outcome was the second part.
Again, if you're not suitable, you will not have the procedure done. So it depends on the corneal thickness. These things will be evaluated. So if we feel that the success would not be there, then your surgeon would advise you clearly what are the factors against it. So depending on the eye examination, if there are any abnormalities at the back of the eye, if the pressure of the eye is high, if the cornea is not thick enough, there are lots of things which we have to check before. And if you're not suitable, then it's better not to have it.
Do you recommend?
Can I ask a question here in this indication? Do patients with both long sight and short sight, both of them can have the procedure, can they?
Yes.
And what's it called? Whatever may be the power, they can have it, is it? Like
Criteria, everything is there. There is astigmatism has to be checked. So based on that, the calculations will be done. But by and large, if it's just a refractive error and if there's no other pathology in the eye, then this is something which can be assessed, and you'll be advised if it's suitable for you.
So do you do this only for as a cosmetic procedure, or do you do this as a kind of a procedure wherein you are making the patient, not the patient, the bearer of this particular procedure feel better? So what is the indication here?
So it depends. See, basically laser eye correction is considered to be cosmetic because you are trying to get rid of the glasses, because the glasses will anyway do the job. And but there are circumstances like professionals and other things where it becomes essential for them. Like a swimmer cannot wear glasses when they swim, and contact lens is a risk of infection. So that becomes a necessity for them. Similarly, there are lots of other professionals in whom it becomes a necessity as well. So, but essentially, bottom line is we are whatever the age group, because the procedure which we choose, like we are just talking about lens refractive surgery here, then there's a lens replacement as well. Then as we grow up, we tend to develop cataract, and there are different ways where we can try and do the refractive procedure. But the purpose would be based on what age group and what the indication is. And the most common indication in this age group is cosmetic.
Right.
Yeah.
Okay.
Yeah, and especially for people like, for example, I'm in the mid 40s, and when I did this surgery, I was in late 30s. So one of the things that I observed, and my doctor suggested it as well, was that by doing LASIK, it actually delayed the need for me to wear my reading glasses. I was told that otherwise, by early 40s, people will tend to, need glasses for reading, especially when you're looking at devices for a longer time. But what I realized is when I did my LASIK, actually started wearing my reading glasses just about 2 years ago, which is about 45.
I think for me, the main reason was probably falls under the cosmetic reasons only. I started wearing glasses when I was same 12, 13 probably. So I wore glasses until I finished school. And then when I did college, I switched to lenses. Um, so that was fine. But then once I graduated, somewhere in the last 2 years, I started getting infections in my eye, or just like it started getting swollen or red. And I've come to Dr. Priya every time. Um, and the reason was that the lenses caused infection. Um, so that's why I've started wearing glasses again and taking eye drops for the same. And when I went to the doctor, he told me that we'll have to do eye surgery to make sure that you don't wear lenses again. So that is one of my main motivations why I want to get it done. So I've been yeah.
Yeah,
Indication.
100%. Yeah. Sorry.
Go ahead, guys. Yeah. Priya, you
Go
were
on,
talking.
Priya.
So the indication is different in different individuals. Like in this case, it was the recurrent infection. We don't want to wear contact lenses if the contact lens is giving infection or inflammation. In a few people, it could be professionally indicated. Like Harini, when she's doing the call, I can see that she's got her glasses up. So if that's obviously showing that she doesn't like the way the glasses giving the glare and other things while on a call. So there are lots of advantages which we get out of this. At the same time, the side effects, it depends on the person, but generally by and large, that's the usual indication to get rid
But
of that.
Yeah.
how long do the results of the eye surgery typically last? Like after a
So
while, does it wear off, or is there anything?
see the if you're looking at the laser refractive procedure, which we are talking about LASIK and stuff, if you get it done in the early 20s, like Ramesh was explaining earlier, until mid 40s, you can be relatively glasses free. But at that stage, you would anyway need reading glasses. So, Ramesh, are you comfortable wearing reading glasses?
Yeah, I am. Look, just like Harini mentioned, my need for wanting to get rid of my glasses started as early as when I was 11, because I used to play sport. I'm an active athlete, but because I was wearing glasses, it prevented me from pursuing sports as a profession, or pursuing sports as an active um, kid. So definitely, not having glasses could have helped me, play sport better. So 100%, it's much more beyond being cosmetic. What I also did is over the period, I used to wear contact lenses ever since it was, I've tried pretty much all types of contact lenses, right from glasses to gels to, disposable, daily disposable, monthly disposable, and all of that. So I've tried, quite a few of that. But I agree with Harini, because some of these lenses can cause. I was told that our eyes can breathe as well. So some of these lenses, wearing them for a longer period, especially for a working professional, you're out of home, and you're literally about 14, 16 hours before you get back home. You it can cause a little bit of discomfort. And what I noticed was that after about 20 or 15 years plus of lenses, different types of lenses, I developed a lot of red lines in my eyes, and that prompted me to just go back to glasses. And I was with glasses for a few years, and I just lacked confidence completely uh, with the glasses, and that's why it prompted me to get this LASIK surgery done.
Good. Nice. Thank you, Ramesh. Thanks for sharing that experience. See, the one thing is, over the age of 50 or 40, the requirement for reading glasses would come back again. That you should be prepared.
Yeah, that's right. And one of the question that I had was, and as part of LASIK, because if you have astigmatism and if you have a little bit of angle, as they call it, I don't think we get 100% correction with LASIK, right? So there's a bit of, they try to correct it with 0.25 or 0.5. Is that right? Is there a possibility of doing 100% correction at all?
See, as I said, 100%, it depends. See how much the astigmatism is, and both eyes. We'll have to, like you were saying, your doctor said that your need for reading glasses would be slightly delayed. So it depends on how much myopia is left. So one eye is fully corrected, one eye is slightly undercorrected to balance these two things. It depends on how the refraction is and how your surgeon and you together decide what you want. So a lot of factors, and the astigmatism, yes, to a certain extent, we will put the access and everything and it will be corrected. A little bit of remnant astigmatism, which is not bothersome, if it is there, doesn't matter. We all will have 0.25, something like that astigmatism. That's the nature of the eye. As long as your eye can focus on it, it's nothing to worry about.
Yeah, that's a good point, because I still remember in one of the consultation setting, the doctor was having a conversation on how much percentage are you willing to get corrected for, and I was like, what are you talking about? And one of the options that the doctor suggested was, we'll correct about up to 60%. So you'll still be wearing glasses. I said, no, absolutely not. I'm not going for the surgery if I have to wear the glasses again. And so that's one thing
So
to
they gave
consider for anybody.
that was a percentage of only 60%, is it?
See, that's what. So we have to discuss all the options. It's the patient's choice.
Okay, all right, okay. So
Yeah, that's something to be
go wrong.
considered.
Okay, all right, I understand what you mean.
Yeah, so let's say, for example, I think it's not about the accuracy. I think it's about, let's say, for example, in my case, I had on my left eye, I had a minus 7.25, and on the right, I had minus 5, and I also had the angular the lenses. So one of the consideration my doctor had was that because of high power, would you really, we will not be able to do up to 7.25. Are you okay if we correct it up to -7, for example? And they were also trying to balance it out on the right side to a particular number. So so that's one consideration I would suggest for Harini and anyone else who are considering to keep in mind as well.
One question here. In the refractive eye surgery, would you be worse off from the refractive perspective? Will you be worse off in the sense that if he is gone for a 7.25, can the power become on the contrary to 8.25 or something of the sort? Or am I stupid in asking the question?
No. Because the shape of the cornea, as Ramesh was saying, it's shaved a little bit with the laser. You won't overshoot it. But after a period of time, a little bit of refractive power can come back again. So the prescription can come back again, and it all depends on how your eyeball is, the thickness of the eyeball. That's why the pre-assessment is very, very important to have this done. Sure, you will have all those workup done when you have it done.
Can you convert a long-sighted person to a short-sighted person?
Yes, it's possible. That's why all the calculations should be done properly and properly assessed.
All right, okay.
Are there any lifestyle changes or anything of that sort you need to follow after the surgery, like the days after the surgery, apart from preventing eye sensitivity? But in the long run, are there any lifestyle changes you need to take?
No, with this procedure, there is no open wound. So once you are well healed and well settled, maybe you will have a little bit of dry eye. So you should increase your blink time a bit more. Make sure be aware of, not leaving it dry for a long time. But otherwise, the whole idea is to improve your lifestyle and make you less dependent on glasses. Is there anything else practically which you would advise, Ramesh?
Yeah, I would add a couple of things to that. One is have some have a practice of wearing sunglasses because it can be when your eyes are sensitive and dry enough, it can be very challenging, especially in looking at the sun, broad sunlight. When you're driving, for example, in the night when you have the vehicles coming from the opposite direction having very powerful lights or high beam as they call it, so you can have a small split second um, exposure to your sun, to your eyes. So it's better to have sunglasses. So that's one that I would recommend. And the second one is um, have those eye drops. And as Priya was mentioning, blink time is important. But if you can't consciously blink more often than you normally do, then I would suggest alternate with the eye drops on a regular basis.
Ramesh, I just wanted to ask you one thing. You told that when you went to the procedure, it was done under local anesthetic. Is that right?
Without any
Yeah.
local anesthesia.
Without any general anesthesia. It was done under local anesthesia. How did you, what exactly happened whilst you were in the theater? Can you explain it to us what exactly happened and what you were subjected to?
So as Dr. Priya mentioned, so my doctor actually narrated what he would be doing as part of the procedure. He clearly explained that there'll be based on they did multiple consultations to examine my cornea, the thickness, and my blood pressure, in the eyes pressure and so on and so forth. So lots of assessments, and then subsequently they explain what are the steps in the procedure, and as part of the procedure there was a brief moment, very brief, I would say few seconds, where I would not have a vision, and then I was told that you would gain back the vision right after that's when they basically chip off the cornea. So and I didn't realize that the whole procedure was complete until I was told that the procedure was complete. So it's as easy
That's
or as
funny.
simple as that.
But
So
one part, it was complete. That one, whatever, how much ever time you said that you had no vision, was it completely like pitch black or like?
very small, yeah, very. It's like a shutdown. It's like a I wouldn't say a split second. It was possibly a second. Maybe Dr. Pia can clarify if it's normal at all. But yeah. So
Now
it's
Harni
like
is scared. Isn't it, Harni? Was it claustrophobic, that particular moment? Was it scary at all,
no, it
Ramesh?
wasn't. It wasn't, because the doctor had explained to me that it would happen. So I was hoping that it was going to be very short and I wouldn't notice it, but I noticed it. So I remember. So that was that. And then post that I remember they had me on some protective measures on my eyes. There was a black glass that was given to me, and then after a few minutes, as Dr. Pierre mentioned, it was a very short procedure, about 10-20 minutes. I was
Were
in the
you
room, and then I
sitting
was
or
out.
were you lying down? Did they make you sit?
No, I was lying down. It was
You were lying down.
yeah.
So the laser
And
beam
then
will be coming from the up north. Yeah.
I thought so. Yeah. I
You
don't
don't.
remember.
Yeah.
Sorry.
It's 10 years now. All right. Okay. Anyhow.
You're
Yeah.
getting one of the interesting thing being part of these doctor in the conversation is you guys get more technical. So, and, but yeah, it was
Yeah.
very short, Harry.
Very short. Okay. Yes, Harini. Are there any other questions?
So are there situations where you get the surgery done, but there's a need to, go back and kind of re-get it, like redo it, or like just having to go back one or maybe more times? Are there situations, or it's just one and done?
Usually, the aim is to finish it off once. Very, very rarely, if the spectacle prescription which is required, corrected, is not fully achieved, a person might need a second procedure. But that is not the usual thing. Usually we try to do it. The aim of the procedure is to finish it off in the first setting.
Okay.
Ramesh, can I ask you a question here? See, you have done this procedure. If you have been subjected to get this procedure done once again, will you have it done?
I think it's a very interesting one, Dr. Prakash. So, considering the the need for me to have it done at that point in time, I would have definitely done it. But if given a choice again, I would possibly continue with my glasses and put up with all those hassles of wearing those glasses again, because I somehow feel that a little bit of chipping of the cornea was a bit of an uncomfortable situation, and no, I wouldn't do it again. In short,
you wouldn't do it again. What is the one? If you have to tell me one particular reason why you wouldn't want to do it again, what would it be? Is it because
the exposure to the light? That split second when you go to a broad sunlight without a sunglass, the exposure to that high light situation. That's one.
Is that same for everyone, or is it just case to case?
Usually the photophobia, it's not that strong after 8 years, but if Ramesh is experiencing that significant photophobia, then it is actually very bothersome to have that phobia, especially
I can imagine that.
light. The sensitivity to light can put you off. But majority of the people tend to cope with that. A few find glare around headlight while driving at night, but they tend to settle down. So usually the success is defined by the person's requirement. If they are happy with the things which they need, then usually they don't have a problem. So it's interesting to note that Ramesh still has photophobia 8 years, 9 years down the line.
Everybody is different at the end of the day.
That is correct. Yeah, because when I remember, just like how Harini is having this conversation, I remember doing these type of conversations before my surgery. I would have spoken to at least 100 people. At least out of 197 had a very, very positive
Go ahead.
opinion about the lifestyle. So I think it's
So 97% of them said yes to go ahead with the procedure. That was advisable.
Yeah.
Okay.
Absolutely.
But did you ask the same question to them, in the sense that would you have it done again if provided an opportunity, if a circumstances?
Absolutely. Yeah. I don't remember anybody saying no, they wouldn't. I think it could be.
So you possibly belong to the small 3% cohort of population,
or could be just 1%. Yeah, absolutely.
All right. So it is not ultimately too bad or anything at all, Harini, to be worried about by the looks of it. Yeah. Anything else that you would like to ask now, since the experts are there?
A lot more clarity now. So thank you to Dr. Priya and Mr. Ramesh on your insights and your personal experiences. They've been extremely informative, and hopefully this session has also provided those who are watching with a much clearer understanding of the process, the benefits, and all the considerations of eye corrective surgery.
Very nice. Thank you very much. Thanks, Harini, for taking part, and thank you, Ramesh, for all your wonderful insights. Absolutely. And experience. Thank you very much.
Absolutely, and thanks for having us on this platform. Really appreciate what you're doing, Dr. Prakash and Dr. Priya. I really appreciate that.
Thanks.
The objective was to share our perspective. In no ways want to scare you off, Harini. I think it's a good procedure for us to have it. Thanks for having us.
Fantastic. Yeah, it was a nice session. Harini, I'm sure with this one, you'll be able to convince your dad for undergoing.
I'll send this link to him and then be like, an appointment, and hopefully, yeah.
Sure stuff. Okay, guys, have a wonderful weekend. It's a Sunday. Sorry for bothering you all, and thanks for offering us the time today. Okay.
Not at
Bye
all.
bye.
Thanks
Bye
for having
Harini.
us.
Bye Ramesh.
Bye.
Bye Priya.
Bye.
Bye.
Have a nice
Bye,
day.
Take
Priya.
care.
Thank you, Priya.
Bye.
Thank you, Prakash.
Bye.